Good afternoon. Welcome to Ambedkar University online session, Abnormal Psychology, Unit 9, Common Therapeutic Approaches to Psychological Disorders by Madhusudan Rao K. Today's objective, we will discuss about history of therapies and understand what are the developments. Then psychoanalytical theory or therapy, humanistic therapeutic approach, behavioral and cognitive behavioral therapies. Apart from these, we will also discuss few other important medical interventions too. Treating psychological disorders. To treat any psychological disorder, we need therapies. And what are they? Psychoanalysis, humanistic therapy, behavioral, cognitive behavioral, and group and family therapies. This is an simplest way to give you a brief of what are therapies and what do they do. Psychoanalysis examines significant patterns and past events. Behavioral therapy changes behavior through observations and use of proper reinforcement. Cognitive identifies and changes destructive thoughts patterns. Humanistic therapy emphasizes the person as well as whole. Then there is one called integrated therapy, introduces strategies from 2 or more types of therapies. So what do you do when you want to select a therapy? Is psychotherapy effective? One has to question which therapy works best for you. How do psychotherapies help people? Culture and values in psychotherapy. Are they maintained? Are the values left behind or values are followed? All these things are kept in mind before approaching a therapist or a therapist following these culture and value norms. As I said, we would also be looking at biomedical therapies. That would make this session very interesting. In biomedical therapy, drug therapies are included, brain stimulants, psychosurgery, and therapeutic lifestyle changes to prevent psychological disorders. As you can see on the right side of the screen, it was very human form of treatment long ago. That is, earlier times, efforts to treat psychological disorders were often cruel and often based on irrational beliefs. So from this stage, there are a lot of changes occurred up until now. Treatment reforms. Reforms pushed for gentler and more humane treatments. Constructed mental hospitals only for mentally abled people. Since 1950s, mental hospitals have been emptied in favor of drug therapies and community-based treatments. Today's therapies, including psychotherapy, biomedical therapies, psychotherapy include treatment involved in psychological techniques, and biomedical therapy prescribe medications and medical procedures. Psychological therapies, the most influential types of psychological therapy, psychotherapies are psychoanalytic, humanistic, behavioral, and cognitive. Psychoanalysis theory was developed by Sigmund Freud. As you can see, is the legendary Sigmund Freud's photo on the right of the screen. And the below photo is the treatment methodology or process, where the therapist thoroughly questions the client and try to resolve the issue. In generally, today it is not practiced as Sigmund Freud was practicing. Sigmund Freud's way of treatment was bringing out the unconscious desires to conscious level, and addressing them was most important part. So, bringing patients' repressed feelings into conscious awareness, giving them insight into the origins of their disorder. As you are aware of the image on your right side, the very famous image, id, ego, superego, consciousness, pre-consciousness, and unconsciousness. The unconsciousness, thoughts, feelings, which were left behind or unaddressed were addressed in bringing them into the conscious state. Techniques used in psychoanalysis. Free association with the client, talking about whatever comes to mind. Psychoanalyst interpretation may provide the patients with insight. What does it mean? The psychoanalyst, Sigmund Freud was known as psychoanalyst. So he used to pose questions, whatever that comes to his mind, that is in ethical way. And he used to ask number of questions and jot it down. And based on that, he used to analyze and give an insight to the patient or client. The patient may transfer to the analyst's emotions linked to other people, that is example, mother or father. The feelings, what here it meant, may transfer his feelings to his mother or father. Even today, this therapy style has been followed in some parts of US, that is America. This can take several weeks too. The treatment can lead from days to weeks or months. So that is very, very expensive. So in contrary to this, psychodynamic therapy have evolved from psychoanalysis. What does psychodynamic therapy mean? Psychodynamic therapy. This tries to help people understand their symptoms by focusing on important relationships such as childhood experiences. Usually this therapy goes on one-to-one rather than group sessions. Short time frame than traditional psychoanalysis. Instead of dealing with their inner feelings, here the therapist addresses the issue. Humanistic therapy. Therapists aim to boost patients' self-acceptance to the situations or conditions. Differences from psychoanalytical therapies. Differences from psychoanalytical theories to humanistic. Excuse me. Focuses on growth, not curing illness. Path to growth is taking responsibility for one's feelings and actions. Conscious thoughts are more important than unconscious. The present and future are more important than past. So unlike Sigmund Freud's psychoanalytical theory or therapy, humanists aim at the present and the feelings and actions. Who proposed humanistic therapy? Carl Rosser. He developed it. It is also called client-centered therapy. Combines the active listening with the genuine, accepting, empathetic environment to promote client's growth. Includes unconditional positive regards from the therapist. What does it mean? If we look at the right side image on your screen, therapists, instead of saying things I believe about the client are untrue, he thinks I believe about the client that client is true. Instead of saying that I am not aware of myself, he says, I know about myself, I can cure. So he is completely accepting, genuinely, empathetically with the patient's or client's growth and is unconditionally positive regard towards the therapy. Active listening. This involves active listening. The first one is summarize, repeat the other's statements in your own words. What does it mean? If the client says, I am not doing well because of so-and-so, then the therapist repeats saying that you are not feeling for so-and-so. Is that right? Also asks clarification. What might be an example of that? So he says after that statement, he asks the client saying that, and what is it? Or what might be that? Can you give an example? So that client can clearly explain what is he going through and reflects feelings. Oh, it sounds frustrating. That's really unbearable. Behavioral therapies applies learning principles to eliminate unwanted behaviors. That is, if child performs an unwanted behavior, instead of scolding them, sit with them, make a friendly atmosphere, treat them. So this is something like classical conditioning technique. Maladaptive symptoms may be examples of classical conditioning responses. There was an experiment conducted by Mower on a bedwetters, connecting a liquid sensitive pad to an alarm. There were frequent bedwetters, and they were of, not just a young adult. He is matured and he is still bedwetting, he or she. But so he want to change this unwanted behavior. So he connected the bed with a sensitive pad to an alarm. Whenever the bed wets, automatically alarm rings and the patient wakes up, urinates and gets relaxed. So the association was with urinary relaxation and waking, stop the bedwetting. Counter conditioning was also done, triggers the stimulus. Example, it's a closed place with the new response, that is relaxation. Exposure therapy and aversive conditioning. Exposure therapy. Treat anxiety by exposing people to the things they fear and avoid. What does it mean? Systematic desensitization associates a relaxed state with gradually increasing anxiety triggering stimuli. So, if somebody is feared of dog or a lizard, that's a common thing happening everywhere in every place. People are feared of lizards. So, systematic desensitizing. The particular client is exposed to that particular triggering stimuli with images or toys of similar lizard or lizards, and slowly getting them acquainted with that image or toys, and slowly making the client accepting. If a lizard is seen, they get adjusted or move away instead of fear. Similarly, virtual reality exposure therapy progressively exposes people to simulations of their greatest fear. As I said earlier, systematic desensitization. Here also, virtually exposing the client to such fears can stimulate positive responses, and client can be brought out of such fears. Excuse me. Aversive conditioning. We will look into an example with anti-abuse. Unconditional stimuli versus unconditional stimuli is drug, unconditional response, nausea. So, a patient addicted to alcohol can be treated using aversive conditioning. Neutral stimulus is alcohol. Unconditional or conditional stimulus is drug, that is anti-abuse. Then unconditional or unconditioned response is nausea. So whenever the client wants to have alcohol, a drug is added to alcohol and he feels nausea. So whenever he sees drug, alcohol, automatically he feels aversion. So conditioned response is associated with conditioned stimuli, that is alcohol with nausea. So automatically the client get averted to alcohol and stops drinking. Operant conditioning. Behavior modification. Reinforce desirable behaviors. Don't reinforce or even push undesirable behaviors. Useful for solving specific behavioral pattern. For example, if you are taking a dog is urinating everywhere. So instead of scolding it, you can make a habit to take it out at particular time and make it get used to it. So behavioral pattern changes whenever you follow particular pattern. Token economy, a procedure in which people earn a token for exhibiting a desired behavior, especially when a child performs a good act, you are giving them some financial gift or stimuli. He get used to it and they keep doing such good habits. This later on, they can exchange the tokens for privileges or traits. That is, they can buy a good thing or something very good, which they may like in future, or immediately that satisfies their feelings. Cognitive therapy. What are cognitive therapies? Teach people new and more adaptive ways of thinking and acting. So as you can see, one of the cognitive therapy model which I have presented here for a PTSD patient, post-traumatic stress disorder. Therapist makes the patient learn about PTSD symptoms, become aware of your feelings, learn how to change the post-traumatic beliefs, and learn skill to challenge thoughts. So this is a systematic way of inducing new learning and coming out of PTSD. Most probably you can see people affecting with PTSD in war zone people, military personnels, children affected with calamities, etc. So to simplify this, a cognitive perspective, I have presented a simple representation. A person losing a job simply believes, saying that internally he believes, I am worthless, it is hopeless, I can't live. What will people think about me? So, which leads to depression. Instead of that, therapist can make them think that my job, my boss is useless. I deserve something better. So I am skillful, I can find a good job, I have no issues. So that doesn't lead to depression. So he is positive and he accepted the situation and he is looking for new opportunities. Beck's therapy for depression. Aaron Beck is a famous psychologist and his colleagues combinedly developed a cognitive therapy which involves, gentle questioning seeks to reveal irrational thinking and then persuade people to stop viewing life in gloomy way. A negative view about the world, negative view about oneself, negative view about future. So, gloomy way, they are completely negative and gloomy, dull. They don't see anything positive. So, these things are replaced with Beck's therapy of depression. He says, what we think affects our thoughts. How we act and feel definitely affect our thoughts. Emotions, what we feel affects what we think and do. What we do affects how we think and how we feel. So, this is what Beck's therapy of depression. To look into an example, many students become anxious before an exam. This exam is going to be impossible. I wish I were better prepared. This is what students think most of the time. To change the negative self-talk, therapists teach people to alert their thinking in stressful situations. I have studied well. Now it is time to show what I know. So this is a positive way of approaching any exam or even a competitive exam. Cognitive behavioral therapy. What does it mean? Integrates cognitive therapy, that is changing self-defeating thinking, with behavioral therapy, changing behavior, shown to be effective at treating anxiety disorders like OCD and depression. Changing self-defeating with changing behavior. So always thinking negative. Instead of that, change your behavior towards that problem. According to Albert Ellis, feelings better is not enough. You have to back it up with action, action, action. Just simply saying, I'm okay, I can do this. Instead of that, you have to show that you can do, and your actions speak a lot than words. Group and family therapies. Most therapies may also occur in small groups, that is family, as you can see in the window image. Groups and family therapies, an unique benefit is that relief to find that others share your problems too. Receive feedback as you try out new behavior. The unique benefit is that, you can share your thoughts and feelings with the family members, and at the same time, you will receive the feedback. You can change your new behavior, or your new behavior's feedback is always given by the members. And family therapy treats the family as a system, view an individual's unwanted behavior as influenced by or directed at other family members. Treat the family as a system. You're treating entire family as a system. View an individual unwanted behavior as influenced by or directed at other family members too. Evaluating psychotherapies. Is psychotherapy effective? Which therapy works best for me? How do psychotherapists help people? culture and value in psychotherapy. How they are followed, ethics or norms are followed or not. Yes, psychotherapy is effective. Reports from clients' perception, almost 90% of the patients at least said fairly well satisfied. Is psychotherapy effective? Clients' perception. Therapists tend to be aware of their own success and the failures of their others. Clinicians' perception, sorry, it's not clients, clinicians' perception. Therapists tend to be aware of their own success and the failures of the others. To objectively evaluate psychotherapies, psychologists turn to controlled research studies. Outcomes of research? Hans Eysenck, in 1950, he showed a research report saying that with or without therapy, about 2/3 of the patients show improvement with time. What does it mean? With or without treating patients, 2/3 of the patients showed improvement with the time. Today, randomized clinical trials show that psychotherapy works. Thus, not undergoing therapy often improves, but those undergoing therapy more likely to improve. Say, Eysenck said, with or without therapy, 2/3 of patients are improved. But today's randomized clinical trials say that undergoing therapy is more likely to improve. It is a better way of treatment. NIMH studies also show that experienced therapists trained in cognitive therapy, interpersonal therapy, or drug therapy, 239 depressed participants randomly assigned to one of those three or controlled group. That is, after 16 weeks, depression lifted for more than half in each of the treatment group. Only 29% improved in control group. So treatment has significance in treating depressed people or disordered people. The graph here shows number of persons. 80% of untreated people have poorer outcomes than the average treated person. As you can see, average psychotherapy client, the red one, good outcome, then poor outcome, 80% untreated people. Figure is a completion of 475 studies. So it has a good empirical data to prove that treatments are necessary for psychological disorders. Which therapy works best? There is no one type which is common for everything. So no one type of therapy is best across the board. Some forms work best for particular problem. Behavioral conditioning for specific behavior problems like bedwetting, phobia, and compulsion. In general, when to seek treatment? As per American Psychologists Association, the list of warning signs are given below. Feeling worthlessness, deep, lasting depression, self-destructive behavior, extreme mood shifts, compulsive rituals, withdrawal from others, fear of preventing daily life, problems with substance abuse, sexual difficulties, etc. So, as I said earlier, apart from those, we will also discuss about biomedical therapies, which are very important, but this is not part of your syllabus. Drug therapies, brain stimulation, psychosurgery, therapeutic lifestyle change. As I said, drug therapies, increase in use of drug therapies coincide with the empty in US mental hospitals. So as the research conducted by APA, these are the findings over a period of time. That is, I think, 1960 to 2000. The rapid decline in the state and country mental health hospital population. So patients admitted in the hospital has been decreased because of the psychotic drug induction. So this is, data given by APA, 1960 versus 2000. So a significant decrease in the admission of psychological disorder people into the hospitals can be seen clearly. Drug therapies, to judge the effectiveness of a new treatment, we need to compare its effectiveness to rate of the following. Rates of the following. Normal recovery among the untreated people, recovery due to the placebo effect. What is placebo effect? There is no actual medicine, but it is given as a medicine. In double blind, what is double blind? Neither scientist nor subject knows who is getting the real drug. In double blind studies, several types of drugs have proven useful in treating psychological disorders. Antipsychotic drug. Drugs used to treat schizophrenia and other forms of severe thought disorders. Useful for treating positive symptoms, that is hallucinations and paranoia. Not as helpful in treating negative symptoms, that is apathy and withdrawal. Working by blocking dopamine receptors, mimicking certain neurotransmitters. Antipsychotic drugs, powerful side effects are there: sluggishness, tremors, twitches. Newer generation antipsychotic produce fewer side effects. Excuse me. Drugs used to control anxiety and agitation, depress central nervous system activity, calm anxiety as a person learns to cope with the fear triggering stimuli. So these drugs were really helping many psychological disorders in many ways. And the latest drugs are giving lesser side effects. Antidepressant drugs used to treat depression and some anxiety disorders. Different types work by altering the availability of various neurotransmitters. Prozac, Zoloft, and Paxil are examples. May take up to 4 weeks to reach the full therapeutic effect. They should not be stopped immediately. They should be used under medical practitioner or doctor. Using anti-depressant drugs. Best approaches may be used antidepressants in combination with the cognitive behavioral therapy. In double-blind trial, placebo produced about 75% of the improvement as active drug. Some conclude that there may be little reason to use except for the most severely depressed patients. Mood stabilization, yes, levels of emotions high and low, as with bipolar disorder, such as lithium. Unclear how lithium works, but 7 in 10 bipolar patients benefit from this. Risk of suicide, 1/6 of those are not taking lithium or prone to suicide. Brain stimulation, electroconvulsive therapy. As you can see on the right side, the woman taking electroconvulsive therapy, the alternative neurotransmitter neurostimulation therapy. Electroconvulsive therapy, a biomedical therapy for severely depressed patients. A brief 30 to 60 second electric current is sent through the brain of an anesthetized patient, can effectively treat severe depressions in the patient who cannot respond to drug therapy. Electroconvulsive therapy, yes, you can see it is there. It was performed in 1972 for 18 days and shown good results too. Alternative neurostimulation therapies, vagus nerve stimulation, deep brain stimulation. These are most latest advanced therapies. Psychosurgery, lobotomy is famous. Lobotomy is, a psychosurgical procedure once used to calm uncontrollably emotional and violent patients by cutting the nerve connecting to frontal lobe to the emotions controlling centers of the inner brain. Lobotomy was performed, as you can see, the person standing between John F. Kennedy and his daughter, Rosemary Kennedy, in the middle, has given lobotomy. Usually decreased misery or tension, also produce a permanently listless, immature, and uncreative personality. Now it is no longer performed. Therapeutic lifestyle changes. Human brain and bodies were designed for physical activity and social engagements. Lack of these can feed depression. Exercise reduces depression and anxiety. Exercise is a useful adjunct to antidepressant drugs and psychotherapy. As you can see, many doctors suggest you saying that go for walking, do regular exercise, no matter what. Keep your body active all the time. This not only helps to reduce depression or anxiety, this will give you long life with good memory. Comparing therapies, yes. Psychodynamic, client-centered, humanistic, behavioral, cognitive, biomedical. Presumed problem. Psychodynamic, yes. Unconscious conflicts and urges. Therapy aims at promoting insight into the repressed mental material. Therapy techniques, psychoanalysis. Therapists' interpretations of patients' memory and feelings. Client-centered, blocking of self-acceptance. Enable growth via unconditional positive regard genuineness and empathy, active, reflective listening. Therapy technique is active, reflective listening. Behavior, dysfunctional behaviors. Presumed problem is dysfunctional behavior. Therapy aims at relents adaptive behavior, extinguishing problem once. Techniques are classical conditioning via exposure or aversion therapy, operant conditioning as in a token economy. Cognitive presumed problem is self-harmful thoughts. Therapy promotes it or aims promote positive thinking. Techniques are training people to dispute negative thoughts and attributions. Biomedical presumed problem, brain or neurotransmitter malfunctions. Therapy aims at restoring healthy biological state. Therapy techniques, drugs, brain stimulation, exercises. Preventing psychological disorders, lifestyle changes can reverse some symptoms. Such changes can also prevent some disorders by building resilience. Resilience is, person getting up after a severe blow or block is called resilience. Getting up, standing against such issue or problem is called resilience, which is the personal strength that helps people to cope up with the stress and recover from the trial and tribulations. Resilience. Faced with unforeseen trauma, most adults exhibit resilience. Most of you know that 9/11 incidents in US, especially those who with supportive, close relationships, they coped up. Holocaust survivors. Everyone knows about Holocaust. I don't need to tell you about that. Struggling with challenging crisis can lead to post-traumatic growth. Cancer survivors had a higher appreciation for life, more meaningful relationships, increased personal strength, changed priorities. Fostering growth and human flourishing. Many psychological disorders are responses to stress. Preventing mental health seeks to identify and wipe out conditions that cause psychological casualties. Employment, income stress, discrimination, etc. So if these things are addressed properly, so we can wipe out many psychological casualties. So mostly it is not just therapy or therapist. Even the state bodies should also come up and provide ample resources to the population so that such incidences which are leading to psychological disorders can be stopped. Thank you so much.